The next time you go for a walk, pay close attention to what happens inside your legs. Do your calves begin aching after roughly the same distance every time? Do your legs feel heavy, weak, tight, or strangely tired? And when you stop walking, does the discomfort disappear only to return when you start moving again? Most adults over 60 blame this pattern on arthritis, weak muscles, or normal aging, but it may be something entirely different. Your leg muscles could be asking for more blood than narrowed arteries can deliver. And here is the part many people never hear. The correct type of exercise can sometimes help you walk farther, reduce symptoms, and regain confidence, even when walking itself is what initially causes the discomfort. But the wrong approach can also be unsafe. You should never blindly exercise through sudden swelling, severe resting pain, a cold or discolored foot, or an open wound that refuses to heal. So today, I will show you the one evidence-based walking method commonly used to help people with poor arterial circulation in their legs. It is called the walk, rest, repeat method. You do not need a gym, you do not need expensive equipment, and you do not need to walk fast. But you must understand exactly when to walk, when to stop, and which warning signs mean you should not begin until you have been examined. Stay until the end, because I will also reveal the most common mistake older adults make when attempting this exercise, and the simple medical test that can help determine whether your leg pain is truly coming from poor circulation. I'm Dr. Richard, and this is what your legs may be trying to tell you. What poor circulation really means. People use the phrase poor circulation to describe almost any uncomfortable feeling in their legs: cold feet, swollen ankles, visible veins, tingling, cramping, numbness, heavy legs. But these symptoms do not all have the same cause. One major cause is peripheral artery disease, commonly called PAD. PAD develops when arteries carrying blood to the legs become narrowed or blocked, most often because of plaque buildup. The reduced blood supply may prevent working muscles from receiving enough oxygen during activity. Think of a garden hose. When the hose is fully open, water flows easily. But when the inside becomes narrowed, a small amount of water may still pass through, while nothing is demanding much of it. The problem becomes obvious when you need stronger flow. Your legs can behave similarly. While you are sitting, the reduced blood supply may be sufficient. But once you begin walking, your calf and thigh muscles demand more oxygen. If narrowed arteries cannot increase the supply, the muscles may begin aching, cramping, burning, or feeling unusually tired. Then you stop. The muscles demand less blood, and within several minutes, the discomfort fades. This pattern is known as intermittent claudication, and it is one of the classic symptoms of PAD. It can affect the buttocks, hips, thighs, calves, or ankles, and is often triggered by walking, exercise, or climbing stairs. But here is something important. Not everyone with PAD feels this classic pain. Some people experience weakness, heaviness, fatigue, or reduced walking speed. Others have no obvious leg discomfort at all. The CDC reports that up to 4 in 10 people with PAD may not experience leg pain. That is why knowing the less obvious signals matters. 7 signs your legs may not be receiving enough blood. Sign 1. Pain appears while walking and improves with rest. This is the pattern I want you to remember. You walk. The discomfort begins. You rest. It disappears. You walk again. It returns. Arthritis pain commonly affects joints, while PAD discomfort is usually felt within the muscles. Nerve-related pain may change when you bend your back, sit differently, or alter your position. PAD discomfort is more consistently triggered by muscular activity and relieved by rest without requiring a major positional change. If this happens repeatedly, do not dismiss it as age. Tell your healthcare provider exactly how far you can walk before it begins and how long it takes to improve. That pattern can provide an important clue. Sign 2. One foot feels colder than the other place. The back of your hand, gently against each foot. Do they feel approximately the same? A persistent temperature difference, particularly when one foot or lower leg is noticeably cooler, can be associated with reduced arterial blood flow. Cold feet can also have harmless causes, including room temperature or reduced activity, but one consistently colder foot deserves more attention than both feet feeling cold on a winter morning, especially when it appears with pain during walking, skin color changes, numbness, or slow healing wounds. Sign 3. Cuts on your feet heal very slowly. A healthy blood supply delivers oxygen, immune cells, and nutrients needed for tissue repair. If circulation is severely reduced, a small blister or cut may remain open much longer than expected. Some people first discover PAD after noticing a sore on a toe or heel that refuses to heal. This is particularly dangerous for people with diabetes, who may also have reduced sensation and fail to notice an injury. Slow-healing sores, ulcers, or darkening tissue require prompt medical attention. They should not be treated with exercise alone. Inspect your feet regularly. Look between your toes. Check the heels, and use a mirror or ask for assistance if reaching your feet is difficult. Sign 4. Skin or hair changes. Reduced circulation may cause the skin on one leg or foot to become unusually smooth, shiny, pale, red, or discolored. Hair may grow more slowly or disappear from the lower leg. Toenails may also grow more slowly. These changes are not enough to diagnose PAD by themselves. Aging, skin conditions, hormones, and other illnesses can produce similar changes. But when they appear alongside exertional pain, a cold foot, or weak pulses, they strengthen the case for evaluation. Sign 5. One calf is becoming smaller. When muscles receive less activity or inadequate blood over time, they may shrink. One calf becoming noticeably smaller or weaker can have several explanations, including nerve damage, an old injury, joint pain, or reduced blood flow. The American Heart Association lists calf muscle loss as one possible physical sign associated with PAD. Compare both legs in good lighting. Do not become alarmed by a tiny natural difference. But a progressive change, especially with weakness or walking pain, should not be ignored. Sign 6. Pain develops. While you are resting, early circulation problems may cause symptoms only when the muscles are working. More advanced disease can cause pain while sitting, resting, or lying in bed. Some people notice burning or aching in the toes and forefoot at night. They may instinctively lower the foot over the edge of the bed because gravity can temporarily improve blood flow. Resting foot pain, particularly when combined with a wound, coldness, or discoloration, can indicate a more serious reduction in circulation and needs urgent assessment. Do not attempt to walk it off. This is the moment to seek medical care. Sign 7. Your legs feel weak. Even without severe pain, many people expect poor circulation to produce dramatic cramps. But the first change may simply be reduced performance. You walk more slowly. Stairs become harder. Your legs feel empty after a short distance. You begin avoiding places that require walking. That gradual loss of function matters. PAD is associated not only with leg symptoms, but also with impaired walking ability, declining physical function, and reduced quality of life. It is also associated with increased cardiovascular risk because plaque may be present in arteries supplying the heart or brain. Your legs may be revealing a whole-body vascular problem. That is why exercise is only one part of the solution. But when it is appropriate, exercise can be remarkably powerful. Why walking can help. When walking causes pain. At first, this sounds contradictory. If walking causes your calf to hurt, why would a clinician ask you to walk? Because carefully structured walking does not simply test your legs. It trains them. Regular walking exercise can improve the efficiency with which your muscles use oxygen, improve muscular conditioning, and help you walk farther before symptoms force you to stop. The improvement is not necessarily because a blocked artery suddenly opens. Your muscles, circulation, movement patterns, and metabolism adapt together. The 2024 American PAD Guideline identifies structured exercise as a core component of care, including supervised exercise therapy and structured home or community-based programs. Supervised exercise is generally preferred because healthcare professionals can confirm the diagnosis, assess safety, and monitor progression. However, structured home walking may be considered when supervised programs are unavailable and a healthcare provider has approved the plan. Now let me show you exactly what this exercise looks like. The 1 exercise. Walk, rest, repeat. Imagine a gentleman named George. George is 72. Every morning, he walks toward a nearby park. After 4 minutes, a tight ache begins in his left calf. He stops at the same bench. 2 minutes later, the pain is gone. George assumes his calf is simply old and weak, so he gradually stops walking. Within 6 months, he becomes even less active. The distance he can cover before the pain begins becomes shorter, not longer. After being evaluated and diagnosed with PAD, George is advised to begin a structured walking program, not random walking, not pushing through severe pain, a deliberate cycle of walking, resting, and repeating. Here is the method. Step 1. Get medical clearance. Do not skip this step if your symptoms have not been diagnosed. Leg pain can come from arteries, veins, nerves, muscles, joints, blood clots, or the spine. Exercise appropriate for one condition may be unsuitable for another. A clinician may examine your pulses, inspect your skin and feet, review your risk factors, and order an ankle brachial index, or ABI. The ABI is a painless test that compares the blood pressure at your ankle with the blood pressure in your arm. It is commonly used to help diagnose PAD. Knowing the cause comes before choosing the treatment. Step 2. Choose a safe route. Begin somewhere flat and predictable. A hallway, an indoor shopping center, a level footpath, or a treadmill if you are confident using one. Avoid uneven ground, steep hills, extreme heat, and isolated locations when you are first starting. Wear supportive shoes and inspect your feet before and after walking, particularly if you have diabetes or reduced sensation. Carry a phone, and consider walking with another person until you understand how your body responds. Step 3. Warm up slowly. Walk at a very easy pace for approximately 5 minutes. The purpose is not to produce pain immediately. Allow your joints, muscles, heart, and breathing to adjust. Stand upright. Relax your shoulders. Take comfortable steps. Do not force an exaggerated stride. If you become dizzy, unusually breathless, or experience chest pressure, stop. Step 4. Walk until mild or moderate discomfort appears after warming up. Increase to a purposeful but manageable walking pace. For someone with confirmed PAD, discomfort may begin after several minutes. Use a simple scale: 0, no discomfort; 1, barely noticeable; 2, mild discomfort; 3, moderate discomfort that is clearly present but still manageable; 4, severe discomfort that forces you to stop. For a home program, do not chase severe pain. Stop when the discomfort reaches a moderate and unmistakable level, or earlier if your healthcare provider has given different instructions. Structured PAD programs commonly use repeated walking intervals followed by rest, gradually building total walking time and distance. The goal is controlled training, not suffering. Step 5. Stop and rest. Stand safely or sit down. Allow the discomfort to settle. For many people, this takes several minutes. Pay attention to whether the symptom behaves predictably. Does it disappear with rest? Does it take roughly the same amount of time? If pain continues getting worse after stopping, becomes severe, or feels entirely different from your usual symptom, end the session and seek medical guidance. Step 6. Begin walking again. Once the discomfort has resolved, repeat the interval. Walk. Notice the symptoms. Rest. Recover. Walk again. During an early session, your total exercise time may be only 10 or 15 minutes. That is acceptable. Over time, the goal is commonly to build toward approximately 30 to 50 minutes of accumulated walking, excluding some rest periods, depending on the program and the individual's health. Supervised programs are often performed several times weekly over several months. Do not compare your first week with someone else's 12th week. Consistency matters more than heroics. Step 7. Record your progress. Write down 4 things: how many minutes you walked in total, how long it took before discomfort began, where you felt the discomfort, how quickly it settled after resting. This transforms vague memory into useful information. At the beginning, George's discomfort appeared after 4 minutes. Several weeks later, it did not begin until after 7 minutes. Eventually, he could reach the park without needing the bench. The improvement was gradual, but what mattered most to George was not the number. It was that his world became larger again. The biggest exercise mistake. The biggest mistake is believing that more pain must mean more benefit. It does not. Severe pain is not proof that an artery is being cleaned. You are not squeezing plaque out of the blood vessel. You are training the body to function more efficiently despite a circulation limitation. Another mistake is performing ankle pumps for several minutes and assuming the circulation problem has been cured. Ankle pumps may provide gentle movement when you have been sitting, but they are not a replacement for evaluation, risk factor treatment, or structured walking when someone has PAD. And no exercise can replace prescribed medication, smoking cessation, cholesterol treatment, blood pressure management, or diabetes care when these are needed. PAD treatment commonly includes structured activity alongside medical treatment and aggressive management of cardiovascular risks. The exercise is powerful, but it is not magic. When you should not begin this exercise. Do not begin or continue the walking routine if you have a new open wound or infected sore on the foot, severe foot pain while resting, a foot that suddenly becomes cold, pale, blue, numb, or weak, sudden major loss of movement, a rapidly worsening change in one leg. These may indicate severe or acute loss of blood flow and require urgent assessment. Acute limb ischemia is a vascular emergency. There is another emergency pattern that must not be confused with PAD. If one leg suddenly becomes swollen, warm, tender, and red or discolored, it may indicate a deep vein blood clot. Do not massage it. Do not attempt to exercise it away. Seek urgent medical care. If leg swelling occurs with sudden shortness of breath, chest pain, faintness, rapid breathing, or coughing blood, call emergency services immediately because a clot may have traveled to the lungs. Remember this distinction. A chronically aching calf during walking that settles with rest may be PAD. A suddenly swollen, warm, painful leg may be a blood clot. A suddenly cold, pale, numb, or powerless foot may indicate an arterial emergency. None of those emergencies should be treated with a YouTube exercise. Who is more likely to develop PAD? Your risk is higher if you smoke now or smoked in the past, have diabetes, have high blood pressure, have high cholesterol, have chronic kidney disease, have known heart or blood vessel disease, or are over 60. PAD becomes more common with age, but it should never be dismissed as a normal consequence of aging. If several of these risk factors apply to you, ask your healthcare provider about PAD, even if your symptoms seem mild. Early identification can lead to treatment that protects not only your legs, but also your heart and brain. 5 actions that support better vascular health. First, stop smoking. Smoking is a major risk factor for PAD and can worsen its progression. Quitting is one of the most important actions a person with vascular disease can take. Ask for help rather than relying only on willpower. Counseling and approved treatments can improve the chance of success. Second, control blood pressure. High pressure damages artery walls and contributes to cardiovascular risk. Take prescribed medication consistently and monitor your readings as advised. Do not stop blood pressure medication because one reading looks normal. It may look normal because the treatment is working. Third, manage cholesterol. PAD is commonly linked to atherosclerosis. Your healthcare provider may recommend cholesterol-lowering medication and a heart-supportive eating pattern. Do not rely on supplements to dissolve arterial plaque. Use treatments supported by your medical team. Fourth, manage blood sugar. Diabetes can damage blood vessels and nerves. It may also make foot injuries harder to feel and slower to heal. Regular foot checks, appropriate footwear, and glucose management become especially important when diabetes and PAD occur together. Fifth, protect your feet. Never walk barefoot if you have reduced sensation or known circulation problems. Check for blisters, cracks, pressure areas, or color changes. Trim nails carefully and seek professional help for a wound that is not improving. Foot care is considered a crucial part of PAD management. Your legs rarely begin by shouting. They whisper. A calf that tightens after 5 minutes of walking, one foot that feels colder, a cut that takes too long to close, a staircase you quietly stop using, a journey to the mailbox that somehow becomes more difficult every month. These changes do not automatically mean you have blocked arteries, but they deserve more than the phrase, "I'm just getting old." If your discomfort repeatedly appears during walking and improves with rest, speak with your healthcare provider and ask whether PAD should be considered. If exercise is safe for you, remember the method. Walk until controlled discomfort appears. Rest until it resolves. Then walk again. Build gradually, record your progress, and stay consistent. The goal is not to prove how much pain you can tolerate. The goal is to reclaim how far you can go, because every extra step may mean another trip to the store without assistance, another walk with your spouse, another afternoon in the garden, another year of moving through life on your own terms. If this video helped you, write, "I'm checking my circulation," in the comments below. And tell me whether your leg discomfort happens during walking, while resting, or after standing for a long time. Like this video, share it with someone who regularly complains about calf pain, and subscribe for more practical guidance on staying mobile, strong, and independent after 60. Take care of your legs. They may be telling you more about your health than you realize. This video is provided for general education only and does not diagnose or treat peripheral artery disease or any other condition. Leg pain, swelling, weakness, numbness, and skin changes can have many causes. Consult a qualified healthcare professional before starting a new exercise program, particularly if you have heart disease, diabetes, severe pain, open wounds, or unexplained leg symptoms. Seek urgent help for sudden one-sided swelling, sudden coldness or discoloration of a limb, severe resting pain, chest pain, or sudden shortness of breath.